Health is one of the key aspects that nobody can always bet in his life, that can always find a better solution to sustain it. A very warm welcome. Health is a challenge today in a global perspective. Of late 2019, we witnessed a global pandemic, that is COVID 19, that took a lot of masses into fear, a lot of masses into depression, a lot of masses lost their lives, and it also brought some people to a standstill in their respective jobs. And what did that one mean? That one meant that life has its own way of telling its own story. So life is one of the fundamental things that we actually need to put up a lot of interest on how we can handle it at every given aspect. When a doctor tells you that it's good to go for a medical checkup after every 6 months or after every 3 months or after every 6 months of the year, do not assume that to be just a normal talk, because we are all walking sick until we are fully diagnosed to know what kind of disease are we suffering from. Cancer used to be one of the most seriously spoken out diseases, and most of the governmental institutions and the faith-based hospitals and the NGOs came out boldly to see that every person that was affected or infected by this disease was taken care of. But it has also been sidelined, just the same way a disability can be sidelined by somebody who does not know that it can also be corrected. So health has become one of the global challenges. Today we also realizing another other uh, diseases that are coming to affect the human life. Does it mean that we are not actually taking a lot of interest about our life? It depends on how you treat yourself. We have engaged so much in so many things to an extent that we don't see the relevancy of going to hospital for medical checks. Some people do say that women are the best people who have befriended the hospitals, because whenever they feel like their body is actually not in place, they always visit the hospitals. But men become the adamant species to visit the hospital. The only thing that can always make them visit the hospital if they have an acute headache or something like symptoms of malaria. So talking about the chronic diseases, that is HIV, that is cancer, that is diabetes, hepatitis. So these are common diseases, though we don't always talk much about them, because whatever comes with it is called stress, because they're always expensive to manage. They always need a lot of attention to manage. But the best important thing is to go for an early diagnosis. That is why we always advocate for each one of us to keep on understanding your body, because we do not have a machine that is placed at a strategic position just to tell you that you're suffering from a given infection. You need to see a medical doctor. The very best you can always do for yourself is to understand your body, which is always actually okay. So how do you understand your body is now becoming a very tricky question to answer to some of us. We have also seen, I remember back then when we were fighting about polio, when we were having so many people growing up with different disability due to polio, and the government took it very interestingly, and the support from non-governmental organization and the and faith-based organization, just to see that polio was actually taken care of. And we thank God the very best that the result came out very clear, and today we have few cases about polio. We also had an outbreak of smallpox, which also the government took interest and addressed that. Today we are suffering from these chronic infections because of late diagnosis. Some of us are found when they are almost at the last stages of these infections. Speaking about cancer, when cancer came up, so many people were so much shocked, and we were all amazed by this new disease because we could see hair, our friends' hairs were falling out. They had to go for a number of chemotherapy just to keep themselves fit. But that did not give any aspect, because the end product of this is death. Today, we are being advised to go for our universal health coverage registration or our NSIF registration, because health is an emergency thing. You never know when you may fall sick. So keep on checking up on how you do your health. You can do your health good when you eat well, when you free yourself from stress, when you get a good time for rest, or you can also be giving your body some, at least some physical exercise just to keep yourself on your body fit. Whatever you do depend on how healthy you are. Even the laughter, for you to laugh in that prolonged way, you must be having some good energy for that. But when you lose that energy because you're sick, people have sold their houses for them to go for different chemotherapy due to some different infection. People have also gone for group support for them to support their health. You who is still fit and fix to flex your body, do not disappoint your body by not visiting the nearest facility or different. If there is a dispensary that can give you comprehensive health coverage services, please do visit that, because health has no assurity. There is no amount of money that we can always bet and say this can support my health till I die. Because you may be betting in for malaria, but malaria test may cost you only 150, and another chronic infection strike you where you need to spend at most 10,000 daily. Like they say, prevention is better than cure. So when we are working towards curing this, we are always losing lives. It is barely 3 years since a chronic infection struck the entire globe, the so-called corona, or if you like rather COVID-19. Vaccines were to be thrown left, right, and center. Pfizer, AstraZeneca, Johnson and Johnson. But today we are living in a free world where we can move, associate with friends. Why don't we do the same? Create an awareness about what you're going through. Share with friends the challenges you're going through. By sharing, you're also giving that immediate person who is also suffering from the same infection a hope to live, because not all of us are having the capability to manage this kind of infections. Some of us are got with wengine wanasema kwamba ni ugonjwa wa dozi. Yeah, ni wadozi tu ndio wanapata. But you're forgetting that the same people we call the wadozis are the same human beings like us. They walk on twos. They see on two. They all reason like us. So do not wait until it is late when the doctor is now telling you like you're on the 4th stage. But the only way we can help you is to give you a few medical tabs for you to sustain yourself for even 3 months, and the only surety we can give you that you're not going to make it. So before it reaches that level, do not wait until it's too late. Keep an annual medical checkup. So do not love a brother because a brother is suffering from an infection. You do not know where yours may next strike. If it may not strike you directly, that it